So we are here talking to Oliver Ruff and Faye Clayton, and they're both Evanston residents. And Oliver is an activist for equity issues in Evanston and a retired educator. And Faye is a retired attorney who focused on litigation, including civil rights. And we're talking today about a very serious and difficult subject, end-of-life care, and specifically medical aid in dying. And about why this is an important topic right now in Evanston. So you may not have heard of the term medical aid in dying. In a nutshell, it is legislation that allows mentally capable adults who have 6 months or less to live to be able to decide to take a life-ending medication so that they don't suffer unnecessarily in their final days. And despite overwhelming support by voters throughout the country, only 10 jurisdictions in the country, most recently Maine and New Jersey, have this legislation on the books. Illinois does not. So Oliver and Faye are both volunteers for an organization called Compassion and Choices, the Evanston Action Team, and they are working hard to get this legislation passed in Illinois. And so we're going to just talk today a little bit about what is medical aid in dying and why we should care about it, and what is Evanston's role in pushing towards state legislation. So tell me more about medical aid in dying and why you are both passionate about getting this legislation passed.
Well, thank you first for this opportunity. This is something where patients determine what direction they want to go to help them remove the unbearable misery and sufferance that they may be having at the end of life.
And what made you get involved in this topic? What inspired you to do this?
I happen to have been at OLLI at Northwestern, at OSHA Lifelong Learning Institute, and there was an individual there who mentioned this to me. And as a result, in talking with her, she told me that that Faye and Missy were coordinators of this Evanston Action Team, and that I should come. I went and sat in on a session, and Faye, in her very congenial manner, shared with me many of the things that, this was about. And I sat and listened, and I had concerns, because my concern first was that, was this the Dr. Kevorkian kind of, direction where, you're ending your life in such a way where people are just helping you. And she clarified that, and she made it very clear that this was not that. This was medical aid in dying, where you are able to get the kind of resources, get the kind of assistance from the medical profession that's informing for you to make a decision. And then you could decide as to whether you want to ingest that medication, but it also gives a basis for discussion with your family members and your friends, whether it's the clergy, whether it's other community personnel, that helps you be able to make a informed decision about what you want to do and how you want to do it before your life is over.
Faye, what made you get involved in this, and how long have you been involved now?
I've been involved a long time, at least 5 years with the Illinois Coalition, and the Action Team has been around for about a year and a half now. We have several dozen members, including Oliver and a lot of other wonderful Evanston residents. I think my passion for the issue came from my parents, both of whom died in hospice, and hospice is wonderful. It's a marvelous option. Palliative care and hospice care are great when you're toward the end of life. They help relieve your suffering. It focuses on comfort, and it does so in a very family-oriented way, but it doesn't go far enough. And seeing some of the final days, where even with the medication and so forth, everything hospice can give doesn't do it quite enough. My dad chose not to take antibiotics when he had pneumonia, and he would have liked to have said goodbye a little quicker, I think. And for myself, if I have the option at the end of my life when I'm terminally ill, I think I'd like to go out on a more peaceful, happy note, maybe even have a little party. So for me, it's probably selfish, but also, like as Oliver said, part of my interest is the education about this. People don't have to choose it. It should be a free choice, like so many other things in life. And I just love it that Evanston is such a progressive community. We have people, in fact, on the action team I've made so many good friends. And it's a wonderful community pulling together to help others make their own free, independent choices. That's why I'm excited about it.
And so tell me a little bit about why Evanston? Why is Evanston in the mix here? And what do you hope to accomplish by spreading the word about this issue in Evanston?
Well, as Faith said, Evanston is considered a very, very progressive community, and Evanston has done a lot of innovative things. And if Evanston is at a position where the resolution is approved and is submitted to Springfield, it provides impetus for other communities to consider this, because they feel that Evanston has given a lot of deep thoughts to this whole aspect, and I think that would give the other communities, as I said, the motivation to promote it in their communities as well, and to encourage their state legislators to approve it.
So what are the next steps in Evanston, where you're now, I know you're talking to different community leaders, community members. What's the next step in the process?
Well, there are a number of things that we've already done in talking with a lot of grassroots organizations, and we are currently talking with many of the clergy. The next step, is you asked for us, would certainly be to submit our resolution to the Evanston City Council, and hoping they will grant their approval so that we could pass it on to Springfield and have the legislators there approve it so that it can become official.
I agree completely with what Oliver said. Evanston has often been a leader, especially in progressive things, everything from environmental to social justice, and this is an area where we should be a leader, I hope. In other states, Compassion and Choices has found that when one city passed a non-binding resolution saying, we want our General Assembly to make this law available to us, as it is in all these other jurisdictions. When that happens and another city does it and another, pretty soon the state legislature passes it. That's what happened in California in 2015. There are local resolutions all around the country that are being passed as we sit here. And I think Evanston is a little ahead of the curve, so I really hope we are the leader in our state, and I think that will be the impetus that we need to get the legislators in Springfield aware of what the issue is, aware of what an important and frankly no-cost alternative it is for people who would like to expand their choices at end of life and really spend their last days more on their own terms. So that's why we're hoping that the Evanston City Council will play that leadership role.
And as Faith said, awareness and empowerment are major points. And if we get this to the City Council and down to the state, that will be an empowering move for not only Illinois, but as other states, try to move their point off the needle, the needle off the point in terms of what they're going to do.
And interestingly, you mentioned, Evanston's is progressive in so many things, including social justice. And I'm wondering if this is at all a social justice issue or a racial justice issue. African Americans and people of color support this legislation. How does it fit into their lives?
Well, talking about social justice, it can be something that's been a question because of the fact that you don't see that many African Americans who are involved in the movement at this time. Partly it's been because of the lack of knowledge, lack of information, lack of access to this kind of communication at this point. And one of my desires and goals is to share with my fellow persons of color that this is something that it took me a while to get to this point. And I feel very convinced and very compelled to share my story because I think it's a very worthwhile journey. And I think that medical aid in dying is something that will prevent so many of us as African Americans, when our parents and relatives have died, have suffered, whether it's in the hospital and other areas where they didn't have access to certain medications, they didn't have access to certain knowledge and resources. Now, with this information being made available, it provides the choices and the options that were not available before. And that's what's so crucial, that we are given options.
If there are people who don't support this legislation, what are they concerned about? What concerns do they raise about it?
Well, there are a number of concerns, I'm sure. And when you talk about the spirituality of some people, will this be in line with the values and with the priorities they have according to their decision-making processes? How is this going to impinge upon their biblical, positions in the churches, with their relatives, with their friends? Does this impact differences of opinion? And we're not saying that we want to coerce you in any kind of way or to promote anything that you don't feel comfortable with. We're just supplying information and knowledge and empowerment so that you can render a decision that is best for you in doing this process.
A lot of the resistance that we've seen, and I've got to reiterate that a vast majority of Americans support it. It's over 70% of Americans that support medical aid in dying as an option, across religious lines, across political lines. People who are opposed to it are often uninformed. They conflate it with suicide. It's not suicide. Every one of the statutes that has provided for it around the country makes clear this is not suicide. It doesn't affect your insurance, it doesn't affect contracts, it doesn't affect anything. You're just you're choosing not to suffer any longer, but you're dying from the terminal disease. And that's what the death certificate will say, the death caused by the terminal disease that you're suffering. So that's one of the misconceptions. Another misconception that some people have had, Oliver made reference to it, is that no one's being coerced. We're just hoping that we can have this option that they have in 10 other states because it's a compassionate and humane option, in my view, but nobody has to pick it. And each one of the laws provides that only the patient can choose it. In fact, the patient has to do it orally and in writing, and doctors have to verify that there is no coercion. It has to be completely voluntary by the patient, and also 2 doctors, in fact, yeah, in almost all, I think in all the states. That's right, Oliver. And you also have to, the other safeguards include that the patient must ingest it themselves. Their family members can be there with them in their final hours, celebrating their life before they choose to end their suffering, but the patient must do the ingesting. And so it's completely voluntary, and therefore it's been more than 40 collective years that these laws have been on the book, and there have been 0 instances of abuse or coercion. So we know that some of the concerns people articulate are just wrong. If they had the information, they would change their mind, and whether they want to use it themselves, at least they wouldn't oppose it for somebody who chooses it. So that's why we're doing this public education.
So talk a little bit more, you mentioned a few of the safeguards. You have to ask for it orally and in writing. Just go through the list of if you are a capable adult, mentally capable adult with 6 or less months to live, and you decide that you want to go this route, how does it work?
Okay. The patient, and only the patient, your kid, your grandmother, nobody can do it for you. The patient must make a oral request and a written request. Varies a little from state to state. Sometimes it's 2 written requests with a little period of time in case you change your mind. They have to make that request to the doctor, who must determine that they are terminally ill, meaning within 6 months of death, by all standard determinations. They have to also determine the patient is mentally capable of making a healthcare decision. They have to be an adult, of course. And then they go through the process of making the request in writing. They have to obtain that prescription. If they choose, the patient can always change their mind. It is always up to the patient. Then they get the prescription. There are safeguards about the safekeeping of the medication if it's in a home with other people. Very strict ones that the doctor, again, must certify to. When the patient takes the medication, it's a complicated medication. It's not like just one pill. There are 3 different steps in most in most states being changed a little from time to time, but the current formulation, there are 3 different medications you take in various, in a certain order with such time between them. And then, and again, it's only the patient who can ingest it. And then it tends to cause right away they go to sleep, and they usually die very shortly thereafter. So it's a very peaceful death, usually in the presence of their loved ones. And then there have to be certifications that if they did use it, that it was all used, or if it wasn't all used, that it was disposed of in certain ways. And so all these very strict safeguards have resulted in what I think is a wonderful statistic: 0 abuses, 0 instances of coercion. You know, one thing I will mention, Nina, is that just having it available eases suffering in itself. And so we find that there's a certain percentage of people who actually acquire the medication and they have it in their cabinet, it's available. And just knowing it's there, if their suffering becomes unbearable, makes their last days and weeks more pleasant, less fearful, there's less anxiety. And so it's almost a third of people who get it who don't actually use it, but it's there and they've derived comfort from it, and they tell you this, and their loved ones tell you that they've gotten comfort knowing that if their mom or dad or spouse or whatever is in terrible pain, they know there's a way they can get relief, because this horrible disease that's terminal is taking their life, but they don't have to suffer every last nanosecond of that suffering, when suffering becomes intolerable. Exactly.
All of us have had relatives, I'm sure, that have gone through this. And it's just traumatic to see that. And we don't want to see it for our relatives, nor do we want to see it for ourselves or experience it ourselves. And that's where we're at on that aspect. We just want to make the information available again so persons can make informed decisions that best suit them.
I'm going to add one other thing on that, because I think that's such an important point. For the people who know they have medical aid in dying available, let's say it's available in your state, and the patient says, you know, that's not for me. I don't mind the suffering. Okay, I'm having trouble with breathing, I'm having pain in my chest, I'm having whatever it might be. That's all right. I've made my peace with this, and it's my choice to bear that suffering. Now, if I were that person's child and saw them doing that without knowing it was their choice, I'd feel terrible. But if I know that my mom or my dad or my spouse or whoever has chosen that path, and it's one they chose consciously, knowing there were other options, right, I'm not going to be as miserable seeing them suffer. Right. And we respect all the choices. Whatever choice a person makes, we just encourage people to think about it and tell their loved ones, so their loved ones will be comforted by the knowledge that this was a choice, as hard as it might be or as easy as it might be.
And you know, one of the questions that I don't think I thought about until right now is how much is it expensive? It's
covered by Medicaid, and it's covered by insurance in most cases. It's for those people who don't have any access to that, or whatever, for whatever reason. I'm told it costs. It's varied. I mean, there was a time when it was very expensive. I heard recently $500, which is not cheap. But most insurance policies, the states that have authorized almost inevitably cover it under their state form of Medicaid. And so the cost is not an issue. But I do pay attention to wanting this to be available to everybody, regardless of their economic situation. And that's one of the reasons why in Evanston we're trying to get the word out to every aspect of the community, not only the churches, but the senior centers. We had a big program at the library, the public library, where we packed the room, and we want everybody to know that this should be an option. We don't really want Illinois to pass it.
And that's the equity issue.
We know that there are huge racial disparities in healthcare in this country, and so I'm wondering if that extends to end-of-life care.
It definitely does extend, because of the fact, again, having access to information. And once you get the information, you can utilize that information to help you in determining how your end of life will occur. And so that is something that may not have been available in the past, because the physicians, you didn't maybe have a choice of selecting the best physicians. You may not have had the choice of getting the medical attention that you needed because you didn't have the financial resources to do that. But now it appears that everybody will, once you get the information, will have the opportunity of determining what your path to your end of life could be.
The same problem existed with hospice. There were decades when, even though hospice was available to everybody and covered by insurance or Medicare and all the other things, it was almost all white people who used it. And it was a tragedy that people of color didn't know about it. They could have chosen it had they known, and it's certainly a humane option that now has become, thankfully, it's become much more widespread in every community. I'm sure there's still some disparities like there are about just about everything in our country, but we want to make sure that this option, first we want to get it available, and we want to make it available to everybody on an absolutely equal basis.
So why initially did hospice, was it only white people who were using hospice? Was it because of lack of information? Was it fear of hospice?
I think all of the above, lack of information, fear. It's a very scary thing when you talk about death. And with people not having information, it even becomes more magnified. Mm-hmm. And I think now with what we're attempting to do, providing more information, it hopefully will diminish that fear where persons will access some of the resources that are available. And I think that will create greater opportunities for communication with family, with the wider facets of the community, and having discussion about this. Because in the past, because it being such a fearful conversation, people just wouldn't interact at all about it. And I think it's been something as a person of color that we haven't really done that. And I think now, because of this becoming more openly available, it allows us to make plans for our final days.
I think it's a gift to your loved ones when you make your wishes known, so that they know that when they honor your wishes, and let's hope they do, that they're honoring you. I mean, I felt that with my parents, even though we had the limitation. There was no medical aid in dying then, but up to the point, they were very clear what they wanted, and I felt good helping them honor their wishes. I hope my children have the same opportunity when I go. And I think it really is a gift, even though, as Oliver says, it's scary, it's painful to talk about death. We're all going to die at some point. So let's just make those plans, and then we can live our life to the fullest up until the end.
I mean, I think that's so important, the being in charge.
Yes.
And making the decision either to not use this way of doing it or to use it.
Exactly.
And it's up to you.
I want everybody to understand that, as Faye stated so clearly earlier, this is not coercion. This is in no way trying to remove the personal aspect. Every decision is a personal decision. And we respect that. We honor that.
Has it ever come up in Illinois, this legislation? Has it ever been discussed before? Is this a new initiative to pass?
I don't believe it's ever been introduced, or if it is, it hasn't been, certainly in my memory. And the bill isn't in Springfield yet. And for this reason, we have to do some public education. In our community, our state rep, our state senator are solidly with us. In fact, they're both members of our action team. And the governor is supportive. But a lot of people, when you say medical aid in dying, they've never heard of it, or they don't, or they think it's, they think it has some aspect of something different. They don't, and so we have to do a lot of public education. I think if Evanston passes the resolution, and it seems like the right kind of thing for Evanston to do, and we can be a leader here, as we've been in other areas. I think other cities will do the same, and I know action teams around the state are moving in that direction. It's really a big movement. There's a groundswell.
It's fascinating.
When we've been speaking recently at various, we've gone to several of the wards, the wards of Evanston. Just spoke at one a couple weeks ago, and not only were we cheered, but people. I got dozens of signatures on the petition right there at that meeting. I very rarely get people who are opposed. And if they are opposed, it's usually, as we discussed earlier, they're misinformed. And so when you explain it's voluntary, and there's nobody can sign you up for it. You have to do it yourself. It's your choice. They usually, some of their objections disappear.
So how can people get involved?
So we certainly would be interested in trying to entertain any kind of conversation we can with them to help them feel more comfortable in his faith. I think so adequately stated. Make them feel that this is a direction of humaneness, because this is a humane movement.
We welcome people to join our action team. We're always ready to have more volunteers, and people do keep signing up. Another way you can get involved is by going on the web and Googling compassion and choices. There's a wealth of information there, and there are also ways you can volunteer to help with phone banking or one thing or another. But if you want to do something locally, we have meetings. We've been having meetings every month for about a year and a half, and anyone who wants to come would be more than welcome. And then in between, we do public speaking engagements. I mentioned the wards. We've spoken at churches and senior residences and a variety of other places. So sometimes people come and participate in that. We'll find lots of good things for any new members who want to get active.
I strongly would encourage persons of color, especially if you have any kinds of reservations or inhibitions about this, to come and find out for yourself. Ask any questions, share any information, because the only way we're going to become more knowledgeable and more comfortable with this movement is to become a part of it and get your information for yourself. Then you can make the best informed decision, not from what I say, but hearing a lot of different perspectives, making that decision, and then I think that you will be, as I have been, convinced that this is the path that I felt for myself that I want to take.